Today we're going to talk about varicoceles. Varicoceles are abnormal dilations of the spermatic veins within the scrotum, the sac of skin that contains the testicles. It is a relatively common condition that affects about 15% of men and usually presents in younger men. Hi, I'm Dr. DeLay, a board-certified urologist practicing in West Columbia, South Carolina, and I specialize in male sexual dysfunction and infertility. Varicoceles can be asymptomatic, meaning they don't cause any symptoms. However, in some cases, they can lead to infertility, low testosterone, or discomfort in the testicle or scrotum. The exact cause of varicoceles is not known, but it is thought to be due to abnormal valves in the veins going to the testicle. These valves are responsible for preventing the backflow of blood from the body into the testicle through the spermatic veins. When they malfunction, blood can pool in those veins, causing them to enlarge and form a varicocele. The varicocele affects the testicle by increasing the temperature of the testicle and increasing the number of what we call reactive oxygen species, which can damage the tissues. The varicoceles are more common in the left testicle. The reason for this is that the spermatic veins going from the left testicle go into the left renal vein, while from the right testicle they drain into the inferior vena cava. The right renal vein has more pressure than the vena cava, therefore that transmitted pressure from the renal vein is more likely to cause a varicocele on the left than the right. A varicocele is diagnosed by the physical exam of your doctor. There is a grading system from 1 to 3, where 1 is a smaller varicocele and 3 is a larger varicocele. Testicular pain caused by a varicocele tends to be dull or throbbing in nature. It is often worsened by standing for a prolonged period of time, and so it's usually worse at the end of the day. It's rarely acute, meaning that it comes on suddenly. For men who don't respond to conservative therapy, including rest and over-the-counter medication, their varicocele may be eligible for a surgical repair. The success rate for the resolution of pain is between 80 and 90%. Leydig cells are the type of cell within the testicle that make testosterone. Studies where the testicle was biopsied in men who had a varicocele showed a lower number of these Leydig cells and a lower testosterone level in these men when a blood test was performed. Studies seem to indicate that varicocele repair will increase the testosterone level, especially if the starting testosterone was less than 300. The typical increase in testosterone is somewhere between 90 and 100 nanograms per deciliter. The relationship between varicocele and infertility is complicated. We know that varicocele is associated with infertility, and varicoceles are more common in men who have male factor infertility. While men will often have an abnormal semen analysis if they have infertility due to a varicocele, a semen analysis isn't always very specific in identifying how the varicocele is impacting the sperm. Repair of a varicocele seems to improve semen analysis results and the chances of pregnancy, both through natural conception and those folks who are undergoing assisted reproductive techniques such as in vitro fertilization. In fact, varicocele repair before in vitro fertilization has been shown to increase the chance of pregnancy and live birth. Once again, the studies are conflicting, but on the whole, the literature shows that varicocele repair is good for male factor infertility. Treatment for a varicocele depends on the severity of the symptoms and the desire for fertility. For men who have an asymptomatic varicocele, treatment may not be needed. However, if the varicocele is causing discomfort or affecting fertility, then treatment may be offered. The treatment options can include surgery or embolization. Surgical treatment for varicoceles involves making a small incision in the groin or lower abdomen and tying off the affected veins. Embolization is a minimally invasive procedure where a small catheter is inserted into the venous system and a substance is injected into the affected veins to block off blood flow, but this is offered at very few centers in the United States. Both procedures are usually done on an outpatient basis and have high success rates in relieving pain and improving fertility. The main complication from a varicocele repair would be wound infection, atrophy or decrease in size of the testicle, or the development of a hydrocele, which is a fluid collection around the testicle. If your surgeon uses an operative microscope and is able to spare the lymphatic tissue around the veins, this decreases your risk of a hydrocele formation dramatically. The recovery from surgery surgery is usually about a week to get back to everyday activities. I usually recommend that men do no heavy lifting for 2 weeks. It sometimes takes a few months for men to notice a decrease in the size of the veins inside of the scrotum. A word about pediatric and adolescent varicoceles. Because of the ethical issues about obtaining fertility testing in a minor, we use different standards to make a decision about varicocele repair when the patient is under 18 years old. Studies have shown that if the affected side is 20% smaller than the opposite side, then the chances of that testicle being impacted by infertility are higher. While this can often be discerned on physical examination, we sometimes use a scrotal ultrasound to calculate the exact volume or size of the testicle, so that if the volume difference is greater than 20%, then we would give consideration to repairing that varicocele. If this content was helpful, please like and subscribe and turn on notifications so that you can see future videos as they are released. Thanks for watching.